There are some questions people feel shy to ask. Period sex is one of them. Is it safe? Is it dirty? Can it cause infections? And can you get pregnant during your period? Today we're going to talk about it openly and medically. Is it safe to have sex during your period? The short answer is yes. For most people, it is safe. There is no medical rule that says you must avoid sex during your period. If it does not cause you discomfort and both partners are comfortable, it is generally safe. Now let's talk about possible benefits. The first one is relief from menstrual cramps. Menstrual cramps happen because the uterus is contracting. During your period, it contracts to shed its lining, and that shedding is your menstrual flow. When you have an orgasm, the uterus also contracts and then relaxes. It is that relaxation phase after orgasm that can help relieve cramps. In simple terms, the muscles tighten, then release, and that release can reduce pain. The second one is mood improvement. During sex, your body releases some chemicals like endorphins, oxytocin, and dopamine. These are often called feel-good hormones. They improve mood, reduce stress, and promote relaxation. For women who feel irritable, sad, or low during their period, this natural chemical release may help. The third one is a possibility of a shorter period. When orgasm causes uterine contractions, it may help expel, meaning push out menstrual blood faster. Some women notice their period end slightly earlier. This does not happen for everyone, but it can happen. The fourth one is increased sensitivity. During menstruation, there is increased blood flow to the pelvic area. The vulva, which is the external genital area, and vagina may feel fuller or more sensitive. For some women, this can increase pleasure. For others, it may increase discomfort. The fifth one is natural lubrication. Menstrual blood can provide natural lubrication. However, if extra lubrication is needed, water-based lubricants are safest. Silicone-based lubricants are also safe. Now, let's talk about the risk. This is the part many people ignore. The first one is risk of sexually transmitted infections. This is very important. Viruses such as HIV, hepatitis B, and hepatitis C are transmitted through blood and bodily fluids. Because menstrual blood is present, the risk of transmission may increase if protection is not used. Also, during menstruation, the cervix, which is the opening of the uterus, is slightly more open to allow menstrual blood to pass. This may make it easier for infections to enter. Barrier protection like condoms is strongly recommended. The second one is vaginal pH changes. The vagina normally maintains an acidic environment. Its pH is usually between 3.8 and 4.5. Acidic environments help prevent infection. During menstruation, blood, which is more alkaline, changes the vaginal pH. This can make it easier for certain infections to grow, such as yeast infections and bacterial vaginosis. Bacterial vaginosis is an imbalance of normal vaginal bacteria that can cause discharge and odor. It is not sexually transmitted, but sex can trigger it in some women. The third one is urinary tract infection. Some women are prone to urinary tract infections after sex. A urinary tract infection happens when bacteria travel into the bladder. This can happen at any time in the cycle, not just during periods. But hygiene and protection are important. Urinate after intercourse to reduce risk. The fourth one is yeast infection in male partners. Men can develop inflammation of the head of the penis after intercourse if yeast is present. This is called balanitis. It causes redness, itching, and irritation. Again, protection helps reduce risk. Now, very important, if you are wearing a tampon, remove it before sex. A forgotten tampon can be pushed further inside the vagina and may require medical removal. The same applies to menstrual cups. Always remove them before intercourse. Now, can you get pregnant during your period? This is one of the biggest myths. Many people believe pregnancy is impossible during periods. That is not entirely true. The chances are lower, but pregnancy is still possible. Ovulation is when an egg is released from the ovary. It usually happens about 14 days before your next period. In a classic 28-day cycle, ovulation happens around day 14, but not everyone has a 28-day cycle. For example, if someone has a shorter cycle, say 21 days, ovulation may happen around day 7. Now, here is the key point. Sperm can live inside the female reproductive tract for up to 5 days. So, if you have intercourse near the end of your period and you ovulate early, sperm may still be alive and fertilize the egg. Also, cycles can change due to stress, polycystic ovarian syndrome, thyroid disorders, and hormonal imbalances. So, relying on "it's my period, I am safe" is risky. If you do not want pregnancy, use protection. Now, for emotional and cultural concerns, there is nothing dirty or shameful about menstruation, and there is nothing medically wrong with consensual period sex. The most important thing is both partners must feel comfortable. Open communication matters. Some people prefer to avoid it, and that is completely fine. Others are comfortable. That is also fine. There is no moral rule here, only personal preference and medical awareness. Now, let's talk practical tips if you choose period sex. 1. Use dark towels or have sex in the shower. Sex in the shower during a period is a safe, hygienic, and often preferred option to manage mess, as running water washes away blood. 2. Use condoms to reduce infection and pregnancy risk. 3. Remove tampons or menstrual cups beforehand. 4. Maintain proper hygiene. And 5. Communicate openly. Finally, period sex is not medically forbidden. It can have benefits. It can have risk. Pregnancy is possible, though less likely. The key is protection, comfort, and communication. If you found this helpful, please like, subscribe, and share it with someone who may need this information. And until next time, stay healthy and be kind to yourself.